Most common surgical tools and equipment. Knife handle. Most commonly used to hold the number 10 blade. This trusty handle can also work hand in hand with the number 11, number 12, and number 15 blade. Knife handle. Similar to the number 3 knife handle, the number 7 knife handle typically holds the number 15 blade, but will work just fine with the number 10, number 11, or number 12. When used in conjunction with the number 15 blade, the medical duo is used to cut deep, delicate tissue. Blade shape and curved edge. This blade is a classic with its traditional blade shape and curved edge, perfect for making small incisions in skin and muscle, and is commonly used in coronary artery bypass operations, thoracic surgery, and repair of the inguinal hernia. Paired typically with the number 3 handle, what is also known as the inside knife is used to cut superficial tissue. Triangular blade. This blade is an elongated triangular blade with a sharp hypotenuse edge and a pointed tip perfect for precise stab incisions. Number 15 blade. Similar to the number 10 blade, the number 15 is ideal for short and precise incisions. It differs mainly in size, being slightly smaller than the number 10. 90-degree dural elevator. As the name suggests, the 90-degree dural elevator is comprised of a straight handle with a 90-degree angle at the tip. This seemingly simple tool is a key player in craniotomy, the removal of part of the skull bone encompassing the brain. Cobb elevator. With more rounded edges than the 90-degree dural elevator, the Cobb elevator is used mainly to cut and dissect when working on paraspinous muscles and removing periosteum, a thick layer of tissue that covers bones at surfaces of joints. Freer elevator. On one end, find a blunt teardrop tip. On the other end, a sharp teardrop tip. Which will be used most? Depends on the procedure. Most commonly used for orthopedic and neurosurgical operations to debulk and lift in conjunction with other instruments in the classic stainless steel, of course. Adson bipolar forceps. The first of our many forceps. Yes, forceps come in many different shapes, names, sizes and specific uses, although not without differences. Adson forceps, just like most forceps, are similar to tweezers made of stainless steel meant to hold onto something else that is hard to hold onto alone, another tool or tissue that may be small or slippery. The Adson bipolar forceps in particular, with their small and tight build, are constructed to allow for more control during the surgical process. Adson Brown forceps. Adson Brown forceps differ with their short jaws and narrow tips, used to pick up delicate tissue. These teeth are not meant to bite but rather hold tissue and cause as little damage or tear as possible, and are used most often in cosmetic and end surgery. Backbiting forceps. Backbiting forceps scissors, most often used for sinus surgery, have a giraffe-like long and slanted neck for easy access into the nasal cavity. Meant to go smoothly into the middle meatus, the thin and tapered shaft help in avoiding disruption to the middle turbinates during operations. Babcock forceps. These big friendly giants are not out to pinch. With identifiable loop blades, their job is to hold intestine and tissue without causing damage. More gentle than the Alice forceps, this gizmo excels in holding onto tube-shaped structures commonly seen in intestinal and laparotomy procedures. The jaws are circumferential and non-perforating. Made to be used in laser procedures, these tools can be coated in non-reflective black polymer coating, which reduces laser reflection to protect patients and staff during surgeries. Carmalt forceps. Belonging to the family of hemostat forceps, tools used in surgery to control bleeding, these forceps feature grooves along the blades while the tips are cross-serrated. This thorough texture allows for a good grip on heavy tissue. Alexander Periosteotome. This double-sided tool is the ultimate two-in-one, with one end crafted into the shape of a mallet and the other into a rough chisel. This is a handy tool in removing tissue, typically in surgeries performed inside the chest. Balfour Retractor. Don't you hate pesky abdominals getting in the way? Now, they don't have to. The Balfour Retractor holds open abdominal incisions in place, allowing the surgeon to work on the area freely. Deaver Retractor. With a similar purpose to the Balfour Retractor, the Deaver Retractor holds open incisions of abdomen and chest. Deaver retractors were developed with the intention to keep the organs inside the abdomen away from surgical apparatuses during the surgical process. In this instance, the curved edges are held by hand or in place by a clamp to allow more freedom for the surgeon to work. This tool is manual and available in various widths. Arm Retractor. Used during general and orthopedic procedures, the arm retractor holds small areas of the body with its 4x4 prongs, which could be sharp or blunt, depending on the procedure. Sen Retractor. This handheld gizmo, typically used in hand and foot surgeries, is a double-ended retractor with one 90-degree angled end and the other end pronged, which can be sharp or dull. The use of this tool is dated back to the 10th century A.D., where it was described in Arab physician Abu al-Qasim al-Zahrawi's medical encyclopedia, Kitab al-Tashrif. Davis mouth gag. Used in oral and oropharyngeal surgery, this instrument is not so unlike the Balfour Retractor, in that it holds open the muscles, allowing the surgeon the freedom to operate. Because this is a strong tool that keeps control of many delicate bones and muscles, isn't the mouth fun? Caution must be taken when opening and moving the lips, teeth, and joints. Alice clamp. Don't underestimate this instrument. Seemingly flimsy, this gadget has sharp teeth that allow a firm grasp on tissue, as it is often used in the process of tissue removal, or to grab on to tendons and fascia. A length of connective tissues, also known as fibrous tissues, found near nerves, blood vessels, bones, muscles, and other organs. In order to reach the site of operation, surgeons are able to travel around the fascia with the help of the Alice clamp. This forceps comes in a number of shapes and sizes, and the surgeon will pick out the one most appropriate for the patient and the procedure. During gynecological procedures, for instance, the Alice clamp with the 4x5 teeth will commonly be used. This instrument will most likely be found made of high-quality steel, as it is meant to be sterilized and reused. Aortic cross clamp. The aortic cross clamp, or simply the cross clamp, is used mostly in cardiac surgery, where the cross clamp is used to hold the aorta. This separates the heart from the body's circulation, and is followed by cardioplegia, a state where the heart refrains from beating. These operations must be quickly performed, or the doctor must take other precautions such as chilling the heart to preserve functionality and prevent damage. If oxygen does not reach tissue for a long period of time, damage can follow. Another risk is the possibility for patients to develop clots, which could then lead to vein blockage or a stroke. These possibilities are caused by the clamping down of the cross clamp. However, releasing the clamp may cause trouble too, such as reperfusion injury, where a body part might be very suddenly flooded with blood flow, which may overload tissues. This tool is a key when it comes to procedures of and around the heart, but since the organs are so crucial and central to the operation of the entire body, it is important to take special care and have a cardiothoracic surgeon nearby. Army-Navy Retractor. This retractor is handheld with broad blades, ideal for getting into and exposing large muscles, and is most often used in orthopedic and general surgeries. The double-ended feature allows for one side, the longer side, A.K. The navy side, to be inserted deeper into the wound. This manual tool is also known as the USA retractor and the U.S. Army Bovie, invented by William Bovie, who contributed to the U.S. medical community throughout his lifetime spanning between 1882 to 1958. The Bovie is an instrument used for electrosurgical dissection and hemostasis. Typically a noun describing the tool, Bovie, can also be used as a verb. For example, to bovie a blood vessel, or to dissect or cauterize the blood vessel with the Bovie tool. Cartilage crusher. With a name worthy of a professional wrestling's championship belt, the cartilage crusher does just what the name suggests, crushes cartilage. Used mostly in reconstruction and rhinoplasty, the tool is joined with a mallet and hit until the desired results are achieved. Castroviejo needle holder. Commonly used in eye surgery, microsurgery, and suturing due to its ability to easily and precisely control the handles. The Castroviejo needle holder has connected handles and sometimes a lock in which the needle is held in place for optimal security. DeBakey Atraumatic Multi-Purpose Clamp. Use this tool either as a hemostat in blood flow prevention, or as forceps to get a better grip on delicate tissues with its atraumatic teeth. The clamp is angled at 60 or 90 degrees. Bone curette. Have a bone to curette? Who doesn't? Look no further than the one and only bone curette. With sharp edges and an easy grip handle, this small ice cream scoop-shaped tip will take care of all your curating needs. Adson cerebellar retractor. Used in neurosurgical procedures, this handy-dandy tool allows surgeons the best control when working with and retracting the cerebellum, a part of the brain located in the back of the skull that connects to muscular activity. When working on this sensitive part of the body, nobody has the time or the arm strength to hold this tool and more. Luckily, it has a locking feature that allows the ring handles to keep their position so surgeons can do it all. Cotyle angular scissors. Did someone sit on these scissors? No. Cotyle angular scissors are designed with a dent in the handle to reach mucosal tissue in the nose and may be used to remove the cartilaginous hump. Also known as turbinate scissors or posterior scissors, these blunt blades come in small and medium sizes. Desmarais retractors. With a curved tip like a flower, the Desmarais retractor is designed to hook beneath the eyelid and is used during intravitreal injections of the eye, which has become a rather common procedure in the United States. Before the tool is used, the patient will be asked to look downward, and the instrument will be inserted under the upper lid, when the doctor will retract the eyelid back to expose the site of injection. Doyen rib rasp. With a long neck, comfortable handle, and horizontal hook, the Doyen rib raspatory is designed for cardiothoracic surgeries. Suitable for righties, lefties, adult-sized patients and smaller ones too. This silver fox has the ability to hold or scrape away at ribs. Duval clamp, also known as the Pennington clamp after Australian surgeon David Jeffrey Pennington. This tool is used mainly to grasp tissue without causing damage, most commonly in intestinal, rectal, and OB/GYN procedures. Fogarty clamp. The Fogarty clamp is not just another atraumatic tissue gripper. This clamp is surfaced with rubber-shod serrated blades that allow for an atraumatic grip on tissues and blood vessels. This rubber shod is a disposable piece and should not be reused for different patients. Fraser suction tube. Invented and named after Michael Fraser, this thin tool is used for suctioning out fluids from cavities in the most precise way. The shaft is made of flexible material, to allow for different and bendable positions during the procedure. If left undealt with, fluids and other materials may begin to build up and hinder the process of surgery. With the Fraser suction tube, the wound is able to stay dry and clear, as the adjustable tool refrains from interfering. Gerald's forceps, used on delicate vessels during vascular surgery. The non-toothed Gerald's forceps are best for optimal precision. Just look at those tips. Often used in cardiothoracic procedures, this tissue grasper comes in light to intermediate weight, and a stop peg to assure that tissues are delicately handled.